Hi, I'm Joe Graydon.
And I'm Terry Graydon. This podcast of the People's Pharmacy is brought to you by Squatty Potty Toilet Stools. They create healthy toilet posture for fast, easy elimination. Learn more about toilet posture and health at squattypotty.com. That's SQUATTYPOTTY.com.
The digestive tract seems to act like a second brain. Can it also impact our immune system and even our joints? This is the People's Pharmacy with Terry and Joe Graydon.
When a 3-year-old boy suddenly came down with rheumatoid arthritis, his parents didn't know what to do. A pediatric rheumatologist recommended a powerful immune-suppressing drug.
They followed his conventional medical advice, and in addition, they also followed an integrative health program that focused on food. The results were astonishing.
Coming up on the People's Pharmacy, we talk with the mother of the boy with a thorn in his joints and the physician who developed the unusual treatment protocol.
First, this news.
In the People's Pharmacy Health headlines, scientists have found a way to counteract the risk of diabetes in women who develop the disease during pregnancy. Although gestational diabetes often disappears after the baby is born, women who have elevated blood sugar during pregnancy are at increased risk for developing type 2 diabetes over the next several years. A new study shows that exercising an additional 20 minutes daily after delivery cuts that risk in half. The study examined data on 4,500 women over 16 years. All of the women had been diagnosed with gestational diabetes during their pregnancies. 635 of them developed type 2 diabetes later. The researchers used data on television watching time and exercise to discover that 19% of the least active women developed diabetes, compared to just 9% of the most active. Watching television was also associated with a 40% higher risk of diabetes. Fitting more exercise into a day can be challenging for a new mother, but these data suggest it pays off in the long run.
Experts have been arguing about statin side effects for years. A recent meta-analysis suggested that muscle pain is not a common complication of drugs such as atorvastatin or simvastatin. New research shows that the studies upon which such analyses are based frequently have not done a good job defining and recording musculoskeletal complaints. The review included 42 statin studies, but only one had specifically asked subjects about muscle pain or weakness. While muscle problems were only slightly more frequent among volunteers taking statins in all the studies, the lack of a standard definition of statin-related muscle problems, or even of a question about muscle symptoms in most of the studies, makes it difficult to sort out what might be statin-related and what are normal aches and pains. Hopefully, future studies will be far more careful about collecting these data systematically so that the results will reveal to what extent muscle problems are actually related to statin use.
We often hear that we are what we eat when it comes to cardiovascular health. A new study shows that may also be true for people with compromised lung function. More than 2,000 patients with COPD were included in the study. The investigators found that people who reported eating fish, bananas, cheese, or grapefruit during the previous day had less emphysema, better 6-minute walk scores, lower levels of inflammatory markers, and improved lung function. The researchers concluded this study demonstrates the nearly immediate effects a healthy diet can have on lung function in a large and well-characterized population of COPD patients.
There's growing evidence that diet impacts the risk of developing diabetes. Long-term data from more than 100,000 health professionals show that increasing meat consumption raises the risk for type 2 diabetes. The investigators analyzed detailed reports of food consumption from the volunteers at the beginning of the study and every 4 years thereafter. Those who increased their consumption of processed meat products such as bacon, hot dogs, sausages, or deli meats saw their risk of diabetes rise over 4 years. Unprocessed meat consumption also had an impact. around 30% elevated risk over such a time span. People who lowered their meat intake by about half a serving a day had a slight decline over the course of the 20-year studies. The researchers are not quite sure what it is about red meat that might be the culprit. Some suggest saturated fat, while others blame it on sodium, preservatives, heme iron, or just extra calories.
Air pollution is hard on lung function. The more particulate matter in the air, the greater the likelihood blood vessel function in the lungs will be compromised. A new study of 42 healthy individuals shows that taking olive oil supplements for a month before being exposed to polluted air helps protect blood vessel linings. This was a randomized trial that compared olive oil to fish oil or nothing. While the fish oil did not offer significant protection compared to control, the olive oil kept blood vessels flexible so that circulation was not significantly impaired. It also reduced the risk of blood clots. The dose of olive oil used was 3 grams per day, a little more than half a teaspoon. And that's the health news from the People's Pharmacy this week.
Welcome to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. Juvenile idiopathic arthritis is a mouthful. It's also called juvenile rheumatoid arthritis. When it strikes young children, it can be devastating. Idiopathic means we don't know what causes it. Treatment can be really tough, especially for children too young to understand why they need to take powerful pills.
We're talking with Susannah Meadows, a journalist who sometimes contributes to the New York Times. She'll tell us about her family's struggle with juvenile idiopathic arthritis.
Welcome to the People's Pharmacy, Susannah.
Thanks for having me.
Susannah, your article in the New York Times Magazine titled "The Boy with a Thorn in His Joints" captured the attention of millions of readers, and it certainly got our attention. It's an amazing story. So why don't you start at the very beginning, if you don't mind. Tell us, when did you first suspect that there was something wrong with your son, Shepard?
Well, I had noticed that he had a kind of intermittent limp, and I figured, well, just he might have hurt himself at the playground. It was not too concerning. It was so slight, but it was something I was keeping my eye on. And then a couple weeks go by, and he was starting soccer for the first time, and he had been so excited about playing, and he and his brother, he has a twin brother, get out in the park, and they were so excited that they had worn their soccer shirts to bed that night and couldn't wait to do it. And then when we got there, Shepard, my son's name, did not want to participate. He sort of looked bewildered and didn't want to kick the ball, and came and after a little while came and sat on my lap for the rest of the practice. So there was something a little off there. But even then I thought, well, he's just, how you kind of think about your kids and you make these conclusions about them that you shouldn't be doing, but you think, well, maybe he's just a little clingy, or which wasn't unusual for him. Anyway, it wasn't until a week later that we were back at soccer. He started running. He burst into tears. And it was at that point, finally, I was clobbered over the head with it, that there was something wrong there. And we then began our series of appointments with various doctors.
Susannah, how old was Shepard at that point?
3.
Okay, so just a little guy.
Yeah.
Tell us what happened when you took him in to see the pediatrician.
Well, the pediatrician said that he really didn't notice anything. He noticed that Shepard was limping a little bit, but he couldn't see anything wrong with the way that his knee looked. He said, I can either send you to the orthopedist or to the rheumatologist. And we thought, well, it's probably just a strain in his knee. Why don't we go to the orthopedist? But it was at the orthopedist appointment where the doctor said, pretty soon after looking at Shepard, he said, oh, I see swelling around his knee, and he did an x-ray, but he said, I'm pretty sure that this is arthritis. And that's when we saw the pediatric rheumatologist, who said right away that he was sure what was going on, that Shepard had juvenile idiopathic arthritis.
Now, that must have come as a huge shock to you.
It was a shock, but it also was strange. Our general understanding, or the most usual understanding of arthritis, is that it's deterioration of joints in people as they get older. And so it was just sort of odd to hear that the 3-year-old could have arthritis. It was just sort of came out of nowhere. And when you hear a diagnosis like that, it's just sort of, especially when you're not familiar with what the diagnosis is, it's very overwhelming, and you have all these questions and you feel more confused, really, than anything.
I'm absolutely sure of that. And since the rest of us also don't know much about juvenile idiopathic arthritis, perhaps you can tell us what you've learned about it since that initial diagnosis.
Well, the main thing about it is that it's an autoimmune disease. So you have osteoarthritis, which is the kind I was talking about earlier, which is deterioration of the joint. But juvenile idiopathic arthritis is related to what we know as rheumatoid arthritis in adults, which is when the body attacks the joints and causes swelling and pain and potentially disfigurement and lack of use. And in some cases, although it's rare, it can cause blindness if there's inflammation in the eye. But beyond that, I have to say there's not a lot known about it. I mean, idiopathic basically means we don't know what it is. And it's very mysterious what brings it on. And although there are some known effective treatments, it's just not well understood.
And it's a serious disease because it can affect joints, it can cause disability, it can cause stunted growth, and it can be incredibly painful. And the medications that are often prescribed are pretty darn toxic. So as you started doing your own research, and I'm sure went onto the web and talked to the pediatric rheumatologist, you were probably getting a little freaked out.
Yeah, I was freaked out by the time we were in to see the pediatric rheumatologist. So from the beginning of the crying at the soccer practice, it was about a month later we finally got the diagnosis. But over just those 4 weeks, Shepard had deteriorated. He was no longer getting out of bed in the morning. So that was obviously, we knew there was something serious going on. And at that point, yeah, we knew we were looking at something that was quite serious.
What other symptoms did he have?
He had very low energy. He couldn't get out of bed in the morning. He would ask to be carried to the couch where he would spend much of the morning. He would, lie on the couch and roll his cars back and forth next to his face on the cushion. His appetite was very low, and for the months that we were getting the disease under control, he was not growing. And I don't know how long he had not been growing. Probably for the couple months previous to that, he had stopped growing because it's a systemic issue, and his body was sick.
And all of his joints were affected?
He had, so there are two kinds. There's polyarticular and not polyarticular. I'm sure there's a word for it that I don't know. So if you have arthritis in 5 or more joints, you're polyarticular. And he, at the start, had, I believe, 6, and then it kind of grew over time. It went into his fingers and into his toes. It felt like every joint. What was surprising at that first visit was we thought it was just his knee that was bothering him. And as the doctor tested every joint, he would say, "Does this hurt? Does this hurt?" And as he would move the joint, and Shepard would say no. But our doctor told us that Shepard was pulling away and wincing as he said no, and the doctor could also detect inflammation in the joint. So he was covering it up for quite a while.
Now, the usual treatment for juvenile idiopathic arthritis must be medication.
Yeah, there is the sort of first line that at least our doctor and many doctors try is ibuprofen, which we all know is an NSAID that's anti-inflammatory, and we tried that first. But even in that first visit with our rheumatologist, he sort of primed us for what was probably coming if the ibuprofen didn't work, which was a drug called methotrexate, which has been around for decades. And, in that way, we were fortunate, as I'm sure you would agree, the newer the drug, the sort of scarier it is. But methotrexate has been around for decades. It's an immune suppressant. And because it's an immune suppressant, it's very effective, but it has some sort of terrifying possible side effects that go along with it.
So how well did the methotrexate work?
Well, it is unclear to me because we tried methotrexate at the same time that we tried other therapies, so it's unclear exactly what was effective with Shepherd. But we did what you do is it takes 4 to 6 weeks to kick in. So initially we started on the methotrexate, and Shepherd seemed to be getting worse. That was when the arthritis was spreading to other joints, and he started waking up in the middle of the night in pain. And when we got to 4 weeks, our rheumatologist said, we've got to up the dose. This isn't working at this level. And it was at that point that we talked about trying these other therapies that we had heard about from a friend of my sister's husband's friend.
That's the sort of thing that probably drives doctors a little crazy. I mean, it's like my cousin's uncle's niece suggested we do something a little different.
Right. And this woman who's not a physician.
Right, is making a recommendation based on her experience. Well, we're going to take a short break. But when we come back, we want to find out a little bit more about the approach that you came up with for your son, Shepherd. The article in the New York Times Magazine that you wrote was called "The Boy with a Thorn in His Joints," and it's a very apt title because the thorn in Shepherd's joints was very serious indeed.
You're listening to Susannah Meadows. She's a journalist who sometimes contributes articles to the New York Times. Her son's diagnosis of juvenile idiopathic arthritis posed a tremendous dilemma for the family. Follow conventional treatment protocols or add complementary medicine to the mix?
And, I can really understand why the family was, in such a dilemma, because the medications do have some pretty serious side effects. I mean, ibuprofen itself has problems, but methotrexate is a powerful drug. And yet, consulting her sister's husband's sister's friend, you can just imagine when she mentions this to the pediatric rheumatologist how he must have shuddered.
I can imagine that, but on the other hand, autoimmune diseases like juvenile idiopathic arthritis are very serious, and there's something of a mystery.
And they're systemic. I mean, it's not just that they affect the joints, although that's bad enough, but as Susannah said, they can affect the appetite, they can affect growth, they can affect the whole body. So it's a really, really difficult disease to understand and to treat. When we return, we're going to find out the details of the alternative therapies Susannah Meadows employed with her son, Shepherd.
Where did this approach come from, and how well did it work? We'll learn about something that's colloquially called leaky gut syndrome. What is it, and what's the connection with antibiotics?
And why are the bacteria in our digestive tracts so important for our overall health?
You're listening to The People's Pharmacy with Joe and Terry Graydon.
Welcome back to The People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is made possible in part by Squatty Potty Toilet Stools, creating healthy toilet posture for fast, easy elimination. More information about how toilet posture affects your health at squattypotty.com.
And by Redix Industries, makers of Utter Cream and Utterly Smooth Extra Care Cream enriched with urea to moisturize dry, cracked skin. The number's 800-345-7339, online at uttercream.com.
If you'd like to order a CD of this show, you can call 800-732-2334. This is show number 911. That number again, 800-732-2334, or find it online at peoplespharmacy.com.
Today we're talking about the connection between the digestive tract and the immune system. What are the implications for treating autoimmune diseases like arthritis?
Our guest is Susannah Meadows. She's a journalist who contributes to the New York Times. Her article was titled "The Boy with a Thorn in His Joints." She was just telling us about her son's diagnosis with juvenile idiopathic arthritis and the first month of treatment with methotrexate.
Susannah, tell us what happened next.
Well, when we started the methotrexate with Shepherd, I was terrified of the possible side effects of the drug and felt that despite the reassurances from our doctor, and we were reassured that it was safe at that dose, but this list of side effects that it can potentially increase lymphoma risk, and the fact that in much higher doses methotrexate is used as chemotherapy, it was just tough to hand over those pills to your 3-year-old and not know what the long-term effects of taking something like that are on a little boy. So I guess I felt desperate, and it prompted me to look at alternatives. Weeks before, my sister had said, well, Alex, her husband, Alex's sister's friend, has a child who had the same diagnosis, and she tried a kind of alternative regimen, and it seemed to work with him. Do you want to talk to this woman, Shar Walker? And at the time, I just was not really open to alternative medicine. I was skeptical of something that, had not been through rigorous clinical trials, and I kind of dismissed it at first. But once we were faced with giving Shepherd the methotrexate, in fact, it was right after we had given him his first dose, I picked up the phone and I called Shar. I just felt, well, if it worked for one kid, maybe it'll work for ours. And it was worth, in my mind, trying, because as I came to know, it was not something that I was not taking any sort of risk and health risk for Shepherd to try what we tried. So we stayed on the methotrexate, although we talked to our doctor about possibly holding off on the methotrexate, trying the alternative thing. He talked us into staying on the methotrexate and then trying our alternative experiment at the same time.
So now we want to know, what is this experiment? What does this alternative therapy entail?
Well, when I called Shar, the mom who had some luck with her own son, and Shar turned out to have a background in integrative medicine. She's a social worker and massage therapist at the integrative medicine department at a hospital in Chicago, outside of Chicago. And what she explained to me was her understanding of what was going on with her son when he had arthritis was that he had leaky gut syndrome. It was something I was not familiar with, but when she explained it to me, it made quite a bit of sense. And the thinking was, if you have a food sensitivity, most likely to gluten and dairy, common perpetrators, that can create inflammation in the gut. And that inflammation can then break down the lining of the gut. And proteins and bacteria that should not be passing through into the system are getting through, and that is triggering an autoimmune reaction. The body is attacking those unwanted visitors. So with that in mind, she told me what she did for her son. What she did was she took out gluten and dairy. She started giving him high doses of fish oil, which is a known anti-inflammatory that's actually been studied quite a bit, and I don't think there's any dispute about the anti-inflammatory properties with fish oil. She gave him probiotics, the thinking being that he needed to restore some good bacteria to just restore the general environment in his gut. She gave him cherry juice, which she believed to be potentially anti-inflammatory. And there was a Chinese herb called Four Marvels powder. And I have to tell you, when she told me that, I thought, oh no, what have I gotten myself into? Four Marvels powder can't really be anything. But I figured, hey, we'll try it. Why not? And I think that's it. Oh, and then we also removed nightshades, that family of vegetables.
So potatoes and tomatoes and
right.
what else?
Eggplant and peppers, which
Okay.
weren't really a part of our diet anyway. So tomatoes and potatoes were more difficult. But I don't know that, that's something that's kind of passed around as being, those things might be possible arthritis triggers, but I don't think much is known about whether they are or they aren't. We took them out anyway.
Now, I have a question. Where did Shar Walker come up with this approach?
So she had, when her son was diagnosed and the rheumatologist had told her, look, you got to go on methotrexate, she said, let me get back to you on that. I'm not ready to do that. There's got to be some way that we can try and tackle this without putting him at risk for liver failure, essentially. So she she just did research. She did her own research. She looked at articles on PubMed, which is the NIH's sort of library of published studies. She consulted the head of her department, the head of the integrative medicine department, which is who's Dr. Leslie Mendoza Temple, and talked to her about what she could possibly do. And so the two of them worked together and came up with this regimen. Now, Dr. Leslie Mendoza Temple has worked with patients with rheumatoid arthritis and juvenile idiopathic arthritis and has tried the regimen before. And as she told me later when I was researching the article, she had seen it work in 80% of her patients who tried it. So Shar had good reason to believe that it might work.
And did it work for her little boy?
It did. She held off on any medication, and she did at about 4 weeks. Her little boy Shane started feeling better, and at 6 weeks, all of his symptoms were gone, and he has been arthritis-free for almost 2 years, I think. And he's had little flare-ups when he's had to take antibiotics, and then he's gone back to normal. So he's in great shape.
So you started trying this same approach with Shepherd. Tell us what happened.
So we started it at around the same time we started the methotrexate, and at the point when nothing seemed to be working, we were about 4 weeks into the experiment, and that was when our doctor wanted to increase the dose of the methotrexate. We said, look, we're just going to give us 6 weeks. That's what Shar said it would take to see some improvement. Let's just see this through. We'll give it 6 weeks. If at 6 weeks Shepherd is no better, we will up the dose of the methotrexate. He was sick, and we knew we couldn't fool around with that. It was a tough time sort of getting to that 6 week endpoint because Shepherd was in pain. We started doubting what we were doing, and my husband was arguing for let's just increase the dose now. I couldn't really stand to see Shepherd in pain any longer. At 6 weeks to the day, Shepherd woke up, and I had gotten in the habit of going into his room to help him out of bed. So I was standing there to see him get out of bed, and he announced, "Mommy, my knees don't hurt anymore," and he ran out of the room. And it was a pretty dramatic turn.
That must have been such a wonderful moment.
It was. It's funny, when I was working on the story, my editor said, "Can you just take us back to that moment, and you've got to describe how you felt." Frankly, I was so happy and overwhelmed. I had a hard time kind of remembering the details of exactly how I felt. It was almost like I was out of my body. It was so fantastic.
So that was a wonderful reinforcement that you were on the right path.
Exactly. And I think that it's possible the methotrexate kicked in late, but we had seen at that point 2 rheumatologists who had said, you are seeing the full effects of this dosage and it's not doing the job. So then for weeks later, Shepherd to dramatically improve. I mean, my hunch is that it was the diet changes and the supplements that we gave Shepherd, although there's no, let me be clear, there's no clear proof what it was that made him better. But I will say that we have had some confirmation that the gluten, at least, is an issue for Shepherd. Once he improved and was symptom-free, We obviously kept him off the gluten and the dairy, figuring that those were triggers for him. And there have been now 4 episodes where he has had gluten accidentally, and every time he has had an immediate flare-up. He's had pain that kicks in either that night or the next morning, and it has sometimes lasted for weeks.
Now, I'm assuming that since you adopted this, we'll call it alternative approach, Shepherd has continued to improve except for these flare-ups when he was exposed to gluten. How's he doing today?
He's great. So once Shepherd was symptom-free, his arthritis was all clear, we began to wean him off the methotrexate, and that's a pretty long process. You normally are supposed to wait 6 months of having no symptoms before you even attempt to wean him off. But our doctor was cooperative with us and let us try it 3 months. Anyway, so it was a long kind of drawn-out period of getting him off the immune suppressant. But it was amazing. Even when we got down to the low dose, we thought we were seeing our old Shepherd back. His energy was improved, and then once he was finally fully off the methotrexate, it was really, he'd been symptom-free for a while, but then the energy came back, his appetite was back, because methotrexate can make you nauseous, and it definitely did with Shepherd. He made a real jump once he got off the medication.
Would you review for us, please, just one more time, the various pieces of this complicated regimen that that you have utilized? And we're also going to emphasize, Susannah, that you and your husband also kept Shepherd under the care of the pediatric rheumatologist as well as his pediatrician.
Yes. So what we did was, this was while he was taking methotrexate, we took Shepherd off gluten and dairy. He already didn't eat a lot of sugar, but we really got his sugar intake pretty close to zero, which sugar can be inflammatory. We gave him high doses of the omega-3s in fish oil. We counted up on the label to get up to making sure he was getting 2,000 milligrams a day of the omega-3s. We gave him a couple tablespoons of Montmorency cherry juice every day, which is thought to be potentially anti-inflammatory. We gave him a probiotic every day. Probiotics are tricky. There's not a lot of good science about what strains of bacteria the human body should have. We're only just discovering what's in there and what's in a healthy gut. But we picked a brand that there had been a couple studies suggesting that it was effective for certain things like diarrhea, and it had at least been looked at and was anyway. So we gave him a probiotic.
And did you actually get some of this Four Marvels Chinese?
Oh yeah, thank
powder?
You for reminding me of the Four Marvels. We did, and so we gave it was a quarter teaspoon a day of the Four Marvels powder, and it was. When I was researching the article, I learned that Four Marvels goes back to the 13th century. It was created by a Chinese physician in the 13th century, although it was originally just 2 marvels, and then they expanded it to 4. But I have to say that, when you're seeing, there's not a lot known, there's not a lot of good science about 4 marvels either, but the fact is something that's been around for 7 centuries is there's a certain comfort you have when it's been used for that long.
Well, leaky gut, for example, sounds like a real weird idea.
Oh, well, the name alone, I think really works against it. It sounds crackpot, and
But you found out that it isn't.
Well, I found out and I also found out that, first of all, it definitely exists. If you just talk to the right specialist, gastroenterologist will tell you, well, of course it exists. And microbiologists who are studying this kind of thing will say, well, and there's this microbiologist I spoke to at Columbia, and I said, so just to be sure, leaky gut, that's a real thing? And he said, well, of course it is. Like, you idiot. Of course. Yes, it is. It's a real thing. It's just not clear whether leaky gut definitely leads to arthritis. I think that piece is not confirmed.
And what's the connection with antibiotics?
Well, if you're thinking that to have a healthy gut, you need all the gut flora, and I think all this research coming out of NIH looking at the human microbiome is showing how fundamental our bacteria is to our health. And I think that you've seen these studies that have been coming out that having the right population of bacteria is clearly related to having good health. So if you take antibiotics, you are disrupting that community. And what is known is that community doesn't necessarily return to normal ever in an adult after having taken antibiotics. So, humans evolved over many thousands of years with this residential bacteria. So it makes sense that if we're going to mess with that population, there is going to be an effect.
Susannah, what would you like the folks listening to us today to take away from our conversation?
I would hope that people would keep an open mind. It was a lesson that I learned that just because something, if it hasn't been proven to work in a clinical setting, it doesn't mean that it still might not be effective. And if trying something like changing your diet or adding various harmless supplements like fish oil might help you, it does, in my view, seem worth giving it a shot because it might work.
Susannah Meadows, thank you so much for talking with us on the People's Pharmacy today.
Oh, it's been my pleasure. Thanks for having me.
You've been listening to Susannah Meadows. She's a journalist who contributes to the newly released book column for the New York Times. Her article, The Boy with a Thorn in His Joints, was published in the New York Times Sunday magazine. There's a link to the full article on our website.
We're going to take a short break, but when we come back, we'll hear from the physician who came up with the protocol that Susannah used to treat her son, Shepard.
Dr. Leslie Mendoza-Temple is Director of Integrative Medicine at North Shore University Health System in Glenview, Illinois.
She will offer her insight into leaky gut. What causes the breakdown of the healthy intestines? Why has the diagnosis been slow to be accepted?
What treatment does she recommend, and why?
Which supplements are best, and what other conditions might this treatment help?
You're listening to The People's Pharmacy with Joe and Terry Graydon. Welcome back to The People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is brought to you in part by Redx Industries, makers of utterly smooth foot cream with shea butter, helping dry, cracked feet feel soft and smooth. The number's 800-345-7339, online at uttercream.com.
And by Squatty Potty Toilet Stools, creating healthy toilet posture for fast, easy elimination. More information about how toilet posture affects your health at squattypotty.com.
To order a CD of today's show or any People's Pharmacy broadcast, you can call 800-732-2334. Today's show is number 911. That number again, 800-732-2334, online at peoplespharmacy.com.
We're talking today about leaky gut and an immune system run amok.
We turn now to Dr. Leslie Mendoza-Temple, Director of Integrative Medicine at North Shore University Health System in Glenview, Illinois, and Assistant Professor of Family and Community Medicine at Feinberg School of Medicine at Northwestern University.
Welcome to the People's Pharmacy, Dr. Mendoza-Temple.
Hi, thank you.
Dr. Mendoza-Temple, we have had an opportunity to speak with Susannah Meadows about her extraordinary experience and her son, and how he has basically made a full recovery from what had been a devastating condition. And in large measure, it was based on your recommendations. So first of all, can you tell us a little bit about leaky gut. We heard about this 10, 15 years ago from naturopaths and chiropractors. It seems like it's beginning to move into mainstream medicine.
Yes, it actually has some traction because it truly exists. And as a conventionally trained family physician, I thought it sounded like other syndromes that conventional physicians tend to blow off a little bit, like fibromyalgia or yeast overgrowth. It's like, oh, there's another one of those wastebasket diagnoses. But as I delved further into why these therapies have worked for my patients, and particularly Susannah's son, is as you dig into the literature, it really does exist. So intestinal permeability, otherwise known as leaky gut, so if we're going to be scientific, I'll call it IP, is the loss of cohesion of gap junctions that are between the intestinal cells that line our small intestines. And that is the area where food absorption occurs, fighting bacteria and viruses that could make you sick occurs. A lot of things happen at that interface, and you can develop leakiness at the junctions between the cells, allowing molecules that shouldn't have gone through into your system, like viruses and bacteria, or it can allow larger protein molecules that should have been broken down further. It lets them into the bloodstream, basically, and then the immune system says, hey, what is that? That doesn't belong here. And then it mounts an immune response, an inflammatory reaction, and ensuing dysfunction. What I've also read about is, okay, does intestinal permeability only affect the gut? Because we know in Crohn's disease and ulcerative colitis, for sure, that's what's happening. But there are distant targets for these molecules that are slipping through the cracks, so to speak, and we're seeing this happening in rheumatoid arthritis, ankylosing spondylitis, and possibly in juvenile idiopathic arthritis. So I've seen more evidence for the JRA, the juvenile rheumatoid arthritis, not so much for JIA, but I'm extrapolating that possibility that it's probably happening in that situation as well from the literature that I've scoured. So, yes, it exists, bottom line.
Do we have any idea what causes this breakdown of, the gut is supposed to provide a barrier as well as a conduit for nutrients, and obviously if it's become permeable, it's not acting like a barrier. So what causes that?
So there are several causes to leaky gut, one of which are medications like antibiotics, which while they destroy bad bacteria and help you fight an infection or prevent an abscess formation, you're also taking out innocent bystanders, and that leaves of good bacteria, which leaves the mucosa more vulnerable to becoming leaky, to yeast and other bad bacteria. I've also seen literature on bad foods that have advanced glycation end products that happen from overprocessing or cooking of certain foods, and that they have been shown to decrease or inactivate parts of your gap junctions that creates a leaky gut. So I think the diet, medications, and I would presume that a lot of stress and other illnesses, those things can also create vulnerabilities in the mucosa, so it's no longer a good barrier. So you have a lot of potential insults to this.
How would you know if you in fact had a permeable intestine?
There are some tests that are available commercially, one of which is called the lactulose mannitol test, where you swallow the sugar mannitol, which is not absorbed in the system. It's not absorbed by your body. So in theory, when you swallow this solution, you should be able to excrete it all out in your stool because it just never makes it into your bloodstream. The theory is that if you swallow the solution and you have a leaky gut, then some of that mannitol sugar gets into your bloodstream, and then it filters through the kidneys and then eventually comes out in the urine. So the urine test will show whether you're getting mannitol in there, meaning it must have leaked through the gut and into the urine, hence one may have leaky gut. So that's the main test that I'm aware of. I don't always test people for it because their story often tells me a lot, whether I think that they've got a hyperpermeable gut. with a history of long-term antibiotic use, multiple urinary tract infections, multiple sinus infections treated with antibiotics, irritable bowel syndrome, skin rashes, strange system-wide problems in multitude in a person clues me in that the gut is probably an issue, and we should just treat it as if it's leaky gut.
Dr. Mendoza-Temple, when you determine that someone quite possibly could have leaky gut or permeable intestines, what do you do? How do you treat it?
So I had mentioned that one of the causes of leaky gut is certain foods. And for some people, gluten, dairy, corn, and soy can be irritants. As much as they are nutritives, for some people they may develop sensitivities. The gut rebels. So the way to heal a leaky gut partially is to take away the offenders. So you go on, I recommend patients go on an elimination protocol, taking out dairy, gluten, soy, and corn for 4 weeks, because you can do anything for 4 weeks is my mantra, and see how you feel after you reintroduce those foods from being clean of them for 4 weeks. And if your symptoms flare up, you know you've developed a sensitivity to that food. So that's one treatment, is take away the offenders. Number 2 is to baby your mucosa. That lovely lining of your gut likes to be pink and healthy and full of life. So you can add supplements, and those would be L-glutamine, aloe vera, deglycyrrhizinated black licorice. So I use combination products that have those ingredients in them, and I have the patient do an elimination protocol, take those supplements, take probiotics as well, and give it some time.
Is there a specific type of aloe vera? I know that it sometimes is used as a laxative.
Yes. So if you look at an aloe vera plant, if you were to scrape all the gel out and get deep to the leaf, and you might see a yellow layer of stuff, that stuff is the laxative part of the plant. The gel part of the plant is the soothing part. So when you get aloe vera, it should be distilled, or should have some guarantee that there's no anthraquinones, which is the laxative portion of the plant. So sure, if you're constipated, take the whole thing, take the whole plant. But it's better to, if you're not constipated, just to stick with the gel, because that's very soothing, which is why we put aloe vera on a burn. Imagine your insides might be kind of burned as well. So taking aloe vera is like a salve. I call it a lotion for your insides.
And what about probiotics? There are so many on the market. Which ones do you recommend?
So the probiotic strains, there's a lot of controversy over which ones are the best. I'm not the probiotic expert, but my experience shows, and the research has looked at Lactobacillus rhamnosus and Saccharomyces boulardii. It's probably 2 big types of bacteria that you want to have in your probiotic blend. But they're coming out with all kinds of different strains, and it's hard to keep track of all of that literature. So I make sure I have at least those, and Lactobacillus acidophilus as well. And I will also go for a dose. So if you want to have general well-being and health, you may want to have 1 to 5 billion colony-forming units of bacteria every day in your probiotic. But if you're trying to treat something like leaky gut, I'm looking at 20 billion and up. Some people even go as high as 100 billion. It depends on how bad things are, but sometimes people feel a little gassy for the first week or so of taking probiotics, as the new guys are being introduced in the gut, and then they get used to it, and then things get better.
How do you even get 20 billion bacteria as a dose?
It's actually the companies are very good at concentrating the colonies, and they're the ones making things as potent as they can be. So that's a question for a supplement company, because you can find the same size capsule will have 1 billion in one company, another company will have it be 100 billion. And bacteria they're obviously microscopic, so billions sounds like a lot, but in our body and on our skin, we have more bacteria in and on our body than we do of our own cells. So it makes sense to me that we have evolved with bacteria. We've evolved with worms, which is another area of interest. We've developed a symbiotic relationship with these organisms, and we've done a good job at creating antibiotics that eradicate the bad guys, but we're forgetting that there's a lot of good guys out there, and they have proven to become our allies in terms of digestive health and immune function.
Dr. Mendoza-Temple, can you share with our listeners some stories? Because I think they're wondering, well, how well does this approach work? So if you can give us some examples of patients who may have come in with some of the immune conditions that you have already alluded to, and how this elimination diet and the additional supplements, what kind of a difference it might make in some of your patients' lives?
Well, I have had some patients, particularly with irritable bowel syndrome and the inflammatory bowel diseases where you have actual erosions in the gut, that have seen a remarkable change in their symptoms, a great relief, some complete resolution, and some it got them 70, 80% better, but they still had to take their medications. So overall, I would say that we've had a very good success rate with treating people with digestive problems, using the elimination protocol, using the supplements I discussed, giving it time, and I recommend giving everything about 3 or 4 months before you assess whether you're going in the right direction. I also want to talk about the importance of keeping stress well managed and having the tools to help reduce anxiety through meditation, breathing, through cognitive behavioral therapy, and just self-regulation, saying no to too many things that are overwhelming you, getting through traumas and stress. That's because your gut is your second brain, and you've probably heard this before, but your gut is your second brain. Treat it as such, and you might find that your emotional state improves when your gut problems go away.
Now, you've mentioned irritable and inflammatory bowel, and I think that makes a lot of sense to folks. But what about autoimmune conditions, in particular arthritis or any other autoimmune diseases that you've treated with this approach? We have a mantra on the People's Pharmacy: if it might help and it won't hurt, and it doesn't cost too much, we like to give it a try. So
I
what
agree
have you?
With that mantra. I love that mantra.
What have you seen in the way of autoimmune problems?
I have seen a lot of relief. I have seen in the children, like Susannah's son and Char Walker's son, they both had amazing resolution because I think as children, they don't have a lot of baggage they bring with them. So for my older patients who have autoimmune disease, I find that it has helped reduce their medication use. I haven't seen folks completely resolve from autoimmune disease completely. I would love to see that, but I find that it's when you pair that with conventional medicine in a thoughtful way with the lowest doses possible, that seems to have helped my patients. And we get pretty complicated cases, lupus, rheumatoid arthritis, Sjogren's. These folks tend to have a lot of other stressors, so we have to work on that as well. So it's very, my answer is it's different for everyone, but most everyone improves in some capacity.
What do you see for the future? I mean, I assume that by now researchers are actually starting to pay attention to this condition. What would you like to tell them and your colleagues who might be a little on the skeptical side?
I would say read the evidence. It's there. Don't use the word leaky gut with your colleagues. Use the word intestinal permeability. That tends to lose a little credibility when you use vernacular terms. It's really there. The treatments are safe. They're not that expensive. And what have you got to lose helping your patient focus on nutrition and well-being as part of their disease management? Combine it all, and don't be afraid, because these are low-risk therapies to try.
Dr. Leslie Mendoza-Temple, thank you so much for talking with us on the People's Pharmacy today.
Thank you for inviting me on the show. I really appreciate it.
You've been listening to Dr. Leslie Mendoza-Temple, Director of Integrative Medicine at North Shore University Health System in Glenview, Illinois. She's also Assistant Professor of Family and Community Medicine at Feinberg School of Medicine at Northwestern University in Chicago.
We spoke earlier with Susannah Meadows. Her article, The Boy with a Thorn in His Joints, appeared in the New York Times Sunday magazine. There's a link to it from our website. And we do have to recognize that her story about her son Shepard is an anecdote. It's an N of one, plus the story about Shane, Shar Walker's son. But other people, too, have experienced some benefit with this approach. It's kind of hard to do research because there are so many factors. And normally in clinical, randomized, double-blind, placebo-controlled trials, there's just one thing against a placebo. In this kind of study, in quotes, we're talking about a number of integrative approaches.
Well, that's part of integrative medicine, is that you do, in fact, use several different modalities. I think it's worth pointing out, though, that as Dr. Mendoza Temple said, there is legitimate research on intestinal permeability.
Indeed, and we'd love to have you share your story at the website. Lynn Siegel produced today's show. Russ Henry and Al Wodarski engineer the program. Dave Grayton edits our interviews.
The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC.
The People's Pharmacy theme music is by B.J. Liederman.
The People's Pharmacy is made possible in part by Red X Industries, makers of Utterly Smooth Extra Care 20 cream with 20% urea for extra skin protection. 800-345-7339. The website is uttercream.com.
To order a CD of today's show or any People's Pharmacy broadcast, you can call 800-732-2334. Today's show is number 911. That number again, 800-732-2334, or at peoplespharmacy.com.
When you go to the site, you can let us know what you think about today's show. Share your own story. You can also check out our books, including The People's Pharmacy Quick and Handy Home Remedies. At peoplespharmacy.com, you'll find answers to your questions about common ailments, prescription medications, and herbs and home remedies.
You can also sign up for our free online newsletter or the free podcast of the show. You'll never miss another People's Pharmacy program again, and you can share it with a friend. It's all there at peoplespharmacy.com. In Durham, North Carolina, I'm Joe Grayton.
And I'm Terry Graydon. Thanks for listening. Please join us again next week.
We hope you enjoyed this podcast. If so, please consider taking a minute to write a review on iTunes. And thanks for listening to The People's Pharmacy.
If you love chilling mysteries, unsolved cases, and a touch of mom-style humor, Moms and Mysteries is the podcast you've been searching for. Hey guys, I'm Mandy.
And I'm Melissa. Join us every Tuesday for Moms and Mysteries, your gateway to gripping, well-researched true crime stories. Each week, we deep dive into a variety of mind-boggling cases as we shed light on everything from heists to whodunits. We're your go-to podcast for mysteries with a motherly touch. Subscribe now to Moms and Mysteries wherever you get your podcasts.